We were looking for local solutions after being told that hospital waste would not be recycled anywhere. We couldn't send it anywhere at all. We were looking for local solutions to keep the costs down. We couldn't find anyone. Everyone approached said, no, all hospital waste is clinical waste. You know, they just view everything as contaminated. I think it comes down to a lack of understanding or education about what's clinical waste and contaminant waste and what's not. And that's why we talked to Mil-tek. I think if you're looking at sustainability, I think local is the best option when you're looking at, your carbon emissions, etc., etc. And then I think if you've got to go further afield, you've got to look at the impact on everything you do, not just sending your rubbish off to the local tip type thing. You've got to look at your transport and what's actually happening to it, because that's what we found previously. We thought we were recycling, like with the yellow bin you have at home, and then we found out even though we were paying extra for that bin, it was still all going to landfill. So it was completely useless. We were paying for a service we weren't getting. So since then, I always check, so the chem guard's going somewhere, where is it going? What are you doing with it? What's it being made into? Is it being processed locally here even in Australia? Is it going overseas? And Mil-tek let me ask those questions and found out the answers for me, rather than just going, oh, don't worry about it, we've got it covered, which is not good enough these days. You have to know everything. And then when I looked more into sustainability and healthcare and realised the huge issue it is for the environment, and it's worldwide, medical waste contributes to 7% of carbon emissions. And then when they talk about the impact of air travel globally was only 2%. I was like, this is ridiculous. Healthcare waste is second only to the food industry, which is mind-boggling to me. So it's not even about being, a tree hugger or doing that sort of right thing. It's just doing the right thing in general. It affects healthcare to such an enormous amount, the asthma, the fires, the floods, the illnesses around it. I think as a healthcare provider, you have an obligation to do the best by your patients, which means you've got to be sustainable. You've got to help the climate change, whatever you believe in. You have to understand that we contribute to the ill health of our patients by not doing the right thing sustainably. It's a circle. I think one of the things that impacted a lot on me was we have these cardboard bins that we're paying a lot of money for, but if you bail them and you can get it removed for minimal cost or for free, there's your savings right there. You can put so much more into a bale than you can in a bin. It's very logical. Part of the solution is by communication amongst ourselves, working together as a healthcare unit, not just this is my hospital and I'm not dealing with your hospital. I think we have to all be working together in an area for a solution and across Australia to find the solutions.